But when we have deficient heart blood or deficient liver yin, then what we're looking at is this, there's no home. There's no plush, desirable resting place for the divine light to come. What that looks like, okay, so deficient heart blood, that's when you're going to see the palpitations, quivering, anxiety, insomnia, the inability to fall asleep. There's an inability because there's no place to rest. There's no place for the spirits to rest. It can also be that waking up, repeated waking up during the night. And of course, all of this with the deficiency of the heart is going to lead to a kind of exhaustion, fatigue, and also a real vulnerability around identity and feeling basically okay in myself. So deficient heart blood looks like that, a kind of fragility, a kind of vulnerability, a shakiness, and exhaustion, fatigue. When we are seeing it more in the liver, and of course, usually they're going to be coming together, one of the things that I've seen over the years again and again is deficient liver blood. These are people who come in the kind of timidity anxiety where I'm afraid even to raise my voice, very anxious around having to show myself in any way. And that also is connected to what I call a lack of faith. Deficient liver blood for me looks like a lack of faith and the kind of deep anxiety and stress and self-doubt that arises from that. When the hun isn't well housed in the liver, it's hard to have hope, which is why, of course, these points, are so important. Liver 14, it's the gate of hope. It's the gate of faith. We want to enrich the liver blood so that a person can actually feel that they have a viable future.
So in this case, we're looking at patients who have too much yang, especially from the neck up, for the shen to settle and relax. So this excess yang is head-related, and physiological symptoms that accompany that are typically headaches or some uncomfortable sensation in the head. So this could be any kind of headache. It might be overthinking where there's rumination. So the uncomfortable sensation in the head isn't necessarily pain, but it's too much brain activity, too much thinking to relax. We might see this in head injuries. We might see this in patients who have post-concussion syndrome or traumatic brain injury, if you will, where the circulation in the head doesn't allow for the more relaxed states of brain waves to support good sleep. I've seen this in patients who also have things like chronic sinusitis or sinus headaches. So too much going on in the head. This is associated with things like PTSD or hypervigilance or this type A personality stuff that we were talking about, where patients have difficulty stopping. They're just too busy. So one begins, as one does with all 8 extra treatments, with a master point. And the master point of the Yangchao is UB62. This is typically done unilaterally. Li Shen, who wrote a whole text on the 8 extras, basically said, and I'm paraphrasing him, that you only need one key to unlock a door. And so if you are using the master point as a master point, you're saying, I'm trying here, or I'm intending now to unlock this system. So it only needs to be done on one side. There are many ideas about which side. There are theories about left and right for male and female. There are also ways of palpating to determine which side is more tender. You can also pick the side based on pulse confirmation. None of that really matters, except for that when you pick a side, you know why you picked that side for whatever reason. So unilaterally, you're going to use UB62 to open the door to the Yangchao.
So it's most often used for insomnia that is waking up too early, and especially when it's associated with night sweats. People might have hot flashes, but they'll be characterized by sweating, and the heat won't be as disturbing to them as the sweating. So we have Guizhitong with the addition of Longgu and Muli. So Guizhitong harmonizes the yin and the wei. What does that mean? It uses this warm Guizhi to bring the yang back into the body and Baishao to hold it there. So we can see over in the east where the yang is coming up, but now we're making sure that it's inside the yin by adding Baishao. Same way we saw it with Baishao with Sunny-san. And again, we have the Xiaoyong Gansao Tong in here. So we have the Baishao holding the yang in so it stays in longer and doesn't separate out. And one thing Guizhi's for is for this flushing up of yang. And Guizhi has a very specific quality of bringing yang back into right relationship. So inside the yin. Then we have the same kind of yin-yang pair as the Guizhi and Baishao with the shengjiang and dazao. So the shengjiang cooks the dazao in the stomach and makes this nice harmonized steam. The yang is inside the yin. And then it mixes with the Guizhi and the Baishao. It's just a beautiful formula for keeping the yang inside the yin all the way up to the surface of the body. And Gansao also is really good for grounding the yang. The sweet flavor is one that, this is the sweetest of the sweet herbs, gansao, honey fried gansao, and it really holds the yang in. So you're strengthening the yang, but making sure it's now being stored well with Guizhi. And then of course, Longgu and Muli, they very much subdue in the East. So they hold it down even more. It really slows down that flaring yang in the East. In addition, they're chalky, and so they're absorptive, and they really help to hold in that sweating. So it's just a beautiful formula. And again, it's especially for early morning waking.
Now, let's briefly go through the different strategies that we can propose. First and foremost is how to evaluate sleep. Insomnia is not just short sleep, it's also poor quality sleep. So in order to diagnose insomnia, the question has to be asked, how do you wake up? If the person says, I wake up tired, that means they did not have enough sleep. Even if they slept 8 hours, the sleep was not good quality. So it's important to define length, but also quality of sleep. It's in our analysis, we also take into account which part of the night is most disturbed. Is it difficulty falling asleep? Is it waking up in the middle of the night? Or waking up too early? And especially, what is disturbed? Is it the quality of sleep which is disturbed? For example, the person has restlessness or sweating or restless leg syndrome, whatever, this is disturbing the quality of sleep. Or they wake up wide awake with a clear mind. So the mental state at the moment of insomnia is very important. It will directly instruct us about the state of blood. Then presence of somatic symptoms, we saw, it will inform about the movement of Wei Qi. Then especially we have to explore the emotional state of the person, in particular after waking up from a dream. Even if they don't remember the dream, what is the emotion that was present? Is it fear? Is it worry? Is it stress? Is it, what is the emotion? Sadness, grief, whatever. What is the emotion present? This will directly orient us towards which zhang organ is trying to release a particular pathogenic factor. We finished the exploration by exploring the 4 extraordinary vessels involved in regulating the time and space of sleep. And these are the Wei and the Qiao channels. Now, tradition has given us Qi cleft points, which are indicative of a disturbance of yin and yang Wei, or yin and yang Xiaoyong.
That's going to be a little bit of the basis of how we can create this pattern. And this pattern is called the Xiaoyong Xiaoyong pattern. Now, we can use this pattern, has many interactions just beyond sleep, as you can see here. Some of them are anything on the side of the body, because they're all middle channels. This is a very useful treatment for that. If you have a Xiaoyong style headache, if you have eye problems. And now we're going to get into our sleeping difficulties. So for example, difficulty falling asleep. That's the transition from daytime to nighttime. So somebody who, they go to bed and they lie in bed and they keep thinking and they keep thinking and they keep thinking and they can't fall asleep. Balancing and interacting the Shui and Xiaoyong will help them move out of that pattern and into a pattern of being able to fall asleep easier. We can also find this with somebody who, because their day is so tiring, they fall asleep easily, but then they wake up and they can't fall back asleep. So the body's need to get some sleep is primordial and takes over the situation. And then what happens is, as soon as the body has enough energy, it wakes up and it can't fall back asleep again. That's another symptom of the Shui and Xiaoyong. Now, we also have this, there's also some other psychological aspects of it. For example, somebody who over-controls their emotions, has over-controlled reactions, they don't express themselves very easily, they're very tight, they're stressed by the amount of things they have to do in the amount of time, they hold their emotions in. All of these go with that problem of not being able to fall asleep. They function very well throughout their day, and as soon as they have this time, all of a sudden their mind starts running about all the things they have to do, all the problems they have. This type of person is a very, I'm sure you can imagine lots of your patients in your clinic showing this. So this is the treatment that we're going to use for them. Now, how are we going to actually have these 4 channels interact? Now, as you can see on your screen, I've already implemented, or I've already given the hexagrams that are associated with each channel.